Hey there, I'm Eric Maland with US Digital Service, HQ. Yay! I've been here since about November working on this thing called Healthcare.gov. You've probably heard about it. Yeah, it was in the news. How many of you have seen Mikey Dickerson speak about Healthcare.gov? That's pretty good. So for those of you who haven't, I strongly encourage you to go on YouTube or the Googles and just Google Mikey Dickerson, Healthcare.gov. You'll see his speech there about like how bad it was, what was broken, how the response team went in. It's a really good story, really good background. What I want to focus on here today is the work that we did this year after that fact. So we've actually fixed some things. Whoa. And there's some real efficiencies in that, so I want to highlight some of those. So one thing we fixed this year is sort of the application process. Last year, the worst case scenario, you had to fill out 76 screens to apply. That doesn't mean you got enrolled. That was not a good experience. And the average time to fill out an application was about 20 minutes. So right before enrollment started this year, we replaced that application with a new thing we call App 2.0. And that brought the worst case scenario down to 16 screens, which is manageable. Still sucks, but yeah. And the average time to complete an application is now 9 minutes, which is pretty good. So that is a good win. The other thing that we replaced is an identity management or authentication system, login service, whatever you want to call it. The previous system was responsible for about 70% of the outages last year, and that was the #1 issue. So we treated that. After enrollment this year, we got this thing launched called the Scalable login service. Before that, the previous solution cost about $200 million to build. Boo. It cost about $70 million a year to maintain. The worst case latency was about 5-second response times in this system, and that aggregates, so there might be 6 or 7 calls in a page. Horrible experience. And the acceptable error rate was about 1.5%. And overnight, that would spike to like in the 20s and above. It was horrible. So we got this thing replaced. It cost us $4 million to build the new solution. It cost about $4 million a year to maintain it. The error rate dropped to 0%, this says, but it's actually like 0.000167% in the first month, which means it threw 10 errors, not 10%. Yeah, it's good. And the maximum response time we've gotten out of this thing is about 20 milliseconds. That's under a load testing environment, which we broke. No, it's good. We actually broke the load testing environment, so that's awesome. So the thing I want to highlight here is that this was a group of 8 developers, and it took them less than a year to replace this system, and it's massively more efficient. They're using agile development processes. We definitely need to move towards more agile procurement and development. This is why. So thank you.